Well, the BBC's Akisa Wandera spoke to Mr. Kaseya, and she began by asking him about the Mpox outbreak, which has spread to several African countries.
Currently, a country like Sierra Leone is the most affected country. Last week, more than 74% of all cases we had in Africa came from Sierra Leone. Now we have Togo, we have Ghana, even Ethiopia affected.
The disease seems to be spreading, especially in countries that are already dealing with conflict. How are you containing these situations?
We are lacking vaccines. We are still not manufacturing vaccines. We lack medicines. But what we are doing with dialogue that we have with a number of partners, it's how to collect the few medicines and vaccines that we have to share with countries affected and to see how we can continue additional effort. Now, I think we are really moving. I think after Sierra Leone, if we manage to control that, we can think about the future without Mpox.
With vaccine shortages being reported in various parts of the continent, how concerned are you about the resurgence of vaccine-preventable diseases such as polio and measles?
When I see the trend from 2022 to 2024, we had increase of 41% of outbreaks. But if you see in 2025, only the first quarter of 2025, we already have more than 50% of 2024. It means 2025 will not be a good year in terms of outbreaks.
How have the recent funding cuts affected the public health systems across the continent?
It's bad because if you see the landscape of health financing in Africa, the first source of financing is what we call out-of-pocket. It means people paying themselves for health services. Immediately after the out-of-pocket, it's the external resources, what we are getting from external partners. And then the third one is national budget. While we could expect to see the national budget to be the first.
But even as you say that, only 2 African countries have met their budget target of allocating about 15% of their national budgets on healthcare. So if countries haven't even achieved this, how are you going to convince these very governments that they need to invest more in health in their countries?
When this Abuja target was decided, we didn't have COVID. And people didn't really think about the impact of an outbreak or a pandemic to the supply chain management and even to the life of a country. With COVID, our leaders, they decided to put in place a strong and powerful Africa CDC. If we didn't have COVID, maybe Africa CDC would not be as powerful as it is today. A number of programs like HIV, TB, malaria, maternal and child program, it was mostly funded by external resources. Then when they decided to cut this money, we saw in a number of countries, people moving from these countries to another one, I will not name countries, to look for HIV drugs. HIV clinics are just locked. And we saw that with UNICEF and Africa CDC, we conducted some studies. The impact, more than 35 countries affected by this aid cut.
Do you think Africa is going to be able to produce its own vaccine anytime soon? Give us a timeline.
We are close to that, very close to that, in a number of areas. Mpox, we finalized the negotiation for the transfer of technology. For other vaccines, we'll discuss about cholera. I don't want to provide information that is still, people are still cooking, but you will see in the next 2-3 years, we'll have at least 4 vaccines coming from Africa, new vaccines.